my name is Shrey Garigavankar, and today I'll be talking about genetic and acquired conditions predisposing to cancer, or also known as precanceroses. So, we need to when we start talking about an answer in the exam, we always need to set certain kind of important points that you want to talk about, which allows you not to be, distracted by other topics. And this is also what the examiner usually wants to know. So the important points over here are three. So one of them is predisposing factors. The second one is chronic non-neoplastic conditions or pre-malignant conditions. And the third one is hormone stimulation. So regarding predisposing factors, so in predisposing factors, you have hereditary predisposing conditions. So these are usually family cancers, and they occur at a relatively early age. So they're usually present in two or more close relatives. Uh, Patients usually inherit one defective gene from the other parent. So when the normal gene is impaired, cancer develops as a result of this. And familiar predisposition makes the risk for developing cancer much higher compared to other individuals. So whenever you talk about anything in general pathology, you want to talk about certain examples as well. So the examiner knows that you know your stuff and you can relate it. So in this, you have certain examples like familial retinoblastoma. So this is an autosomal dominant inheritance pattern, and it's associated with bilateral retinoblastomas, and the gene involved is the retinoblastoma gene. You also have familial polyposis coli. So these involve polypoid adenomas, and they may be seen at birth or an early age. And in these patients, they usually have a colectomy, which is where they remove a good portion of the colon, and that's because they have an almost 100% chance of developing cancer by age 5. The third one is multiple endocrine neoplasia. So these involve a combination of different endocrine neoplasms. So for instance, you may have the pituitary gland, you may have the parathyroid gland, the adrenal gland, as well as the endocrine pancreas involved. And finally, you have breast cancer, as you guys know, pretty popular genes, BRCA1 and BRCA2. The second point is the interaction between environmental and genetic factors. So most cancers in general are sporadic, and environmental factors are they play a high important role in developing of these cancers. So certain instances, for instance, often involve inherited variations in enzymes such as components of the cytochrome P450 system that metabolizes procarcinogens to act carcinogens. So it's important to note that different people may have different isoforms of this enzyme system, and as a result, they may have different activity or affinity for the substrate, for instance. Um, you also have cancer genes, which are genes that are recurrently affected by genetic aberrations in cancer. And these genes are usually four of them, so like four types of genes. So you have oncogenes, you have tumor suppressor genes, then you have genes regulating apoptosis, as well as apoptosis and genes regulating interaction between tumor cells and host cells. So there's four. And you also have germline mutations, which play an important role in cancer risk and susceptibility. And these mutations are present in every cell in the body. The third point in predisposing factors is acquired predisposing conditions. So these may involve racial and geographic factors. For instance, you have certain examples like stomach cancer, which is more common in Japan compared to USA. The examiner may ask why Japan specifically, and it's usually because of consumption of high amounts of smoked foods, and smoked foods usually contain some amount of nitrosamines, which are basically a carcinogen. You can also have breast cancer, which is more common in USA compared to Japan. You may have hepatocellular carcinoma, and this is more common in Asia. And that's mainly because hepatitis B is usually endemic in Asia. And one of the complications of hepatitis B is cirrhosis, which eventually leads to development of hepatocellular carcinoma. if not treated. Um, we also have prostate cancer as well, which is more common in African American compared to Caucasian. Regarding the environmental factors, as we know, cigarette smoking is one of the most important causes of lung, oral cavity, pharynx, and laryngeal cancers. We also have alcohol abuse, which is, as you know, chronic alcohol abuse associated with liver cancer. And you also have like alcohol and tobacco together increase the risk of cancer even more. Circumcision is actually a protective factor. Circumcised males, especially Jews and Muslims, they have a lower incidence of penile cancer, and their sexual partners have lower risk of cervical cancer as well. You may have industrial substances which increase the risk of cancer. So this may involve arsenic, for instance, asbestos, which is associated with mesothelioma and lung cancer. You may have benzene. And finally, you also have occupational exposures in general and diets. So, for instance, a fat-rich diet or a diet that's low in fiber content. These are usually associated with certain colorectal cancer. And finally, you have age. So one of the most important risk factors. Different ages may be associated with different kinds of cancers. So, for instance, in children, the most common cancer is leukemia. In males, approximately 15 to 35 years of age, the most common is testicular cancer, usually due to high replication of cells in the testes. And in elderly, the most common is colorectal cancer. Uh, the next one is chronic non-neoplastic conditions. So these are acquired precancerous conditions. So precancerosis, which is basically a pre-malignant lesion, are acquired conditions that predispose to cancer, and basically they increase the frequency of malignancies. Uh, you need to know like a certain specific number of cardinal principles, which involve chronic neoplastic conditions. So basically, with anything with chronic inflammation. So any process associated with cell replication. This may lead you to increased rates of mutation development. Precursor lesions are basically localized disturbances of epithelial differentiation that are associated with an elevated risk of developing carcinoma. So precancerosis may involve disorders associated with, for instance, chronic inflammation, as mentioned, immunodeficiency states, and other precursor lesions. And in general, these are mainly pseudotumor processes with dysplastic features. So some important processes and lesions are carcinoma in situ, or also known as intraepithelial neoplasia, when the cytologic features of malignancy are present, but the malignant cells are confined to the epithelium without invasion across the basement membrane. So these are three important examples I have for you. The first one is columnar junction of the cervix. So usually at the junction of the ecto and endocervix, you have what is known as the transitional zone, which is between the squamous epithelium of the vagina and the columnar epithelium of the endocervix. So at this region, you usually have cervical carcinomas develop. The second one is oral leukoplakia. So it's basically a thickening of the squamous epithelium, and this may give rise to squamous carcinoma. And you also have Bowen's disease of the skin. So it's also known as squamous cell carcinoma in situ, and it's considered as an early stage of intraepidermal form of squamous cell carcinoma. You may have some benign tumors as well. So in general, benign tumors don't usually become malignant. However, there are certain exceptions which involve certain examples over here. For instance, multiple villus adenoma of the colon and neurofibromatosis, which is associated with the neurofibromas. You can also have precancer metaplasia. So it's basically adaptation in short term, but in long term, it may acquire more mutations and can lead to malignancy. So certain examples of this is Barrett's esophagus. So as you know, Barrett's esophagus is basically metaplasia of the lower portion of the esophagus from the normal stratified squamous epithelium to the intestinal simple columnar epithelium with goblet cells. And this mainly occurs due to gastric reflux. You also have intestinal metaplasia of the stomach, so this is due to pernicious anemia. You may also have squamous metaplasia of bronchial mucosa, so this is usually in response to smoking. The next one is chronic inflammation, as mentioned. So, for instance, ulcerative colitis, liver cirrhosis, chronic bronchitis, Marulin ulcer, and in immunodeficiency states. So, particularly of T cell immunity to those that's usually associated with the increased risk of cancer, especially oncogenic cancer. Finally, you have hormone stimulation. So, cancer is more likely to develop in organs and tissues proliferation under the influence of excessive hormonal stimulation. So, you have different kinds of tissues associated with this, for instance, the breast, the uterus, vagina, thyroid, liver, testes. So, in general, anabolic hormones usually have a higher potential to induce cancer. So when we talk about estrogen, especially in postmenopausal women who take estrogen hormonal therapy, mainly for osteoporosis. So estrogen can induce endometrial hyperplasia and dysplasia, which is, as mentioned in women in unopposed estrogenic stimulation, which can lead to endometrial carcinoma. You also have contraceptive hormones, so these increase the risk of developing breast cancer, and anabolic steroids. So these are usually consumed by athletes to increase their performance during the sport, and they increase the risk of developing both benign and malignant tumors of the liver. So that's all from me. Thank you.